Good morning, friends. Today, week 7, lecture 3rd. Myself, Dr. Atul Sharma. In this week, in this lecture, we study about female athletes. Female athletes are the half of the sports persons are females, and there are some peculiarities by which male and female athletes are different. So first, we discuss about the differences between the male and female athletes. What are their difference? We will discuss in the skeletal differences, body composition, physiological differences, and training and performances. So first, we discuss about the skeletal differences. So male and female body are almost normal or almost equal till the age of 9 to 10 years of age. At this age, female got his first growth spurt, and she developed her thalamic breast development, and she grows as compared to the male counterpart is in height. And sometimes menarche also occurred at this age. At the age of menarche, it depends on the nutritional and the socio-economical data of that society. So, at the age of 9 to 10 years, the female athletes grow in height as compared to male counterpart. And the second growth spurts attained at the age of 15 to 17 years, and during this total growth period, she take if their parents or their genes are allowing genes are like that, she get a height difference of 5 centimeter from the is. And during this entire process, she develops a peculiar female body types like narrow shoulders and wide hip portions or wide pelvic regions, and these are the specific to accommodate wide pelvis is to accommodate uterus and or her reproductive organs, as females has to carry kid in her womb during pregnancy, so that required widening of pelvis. So there are skeletal differences like their bones are shorter, and the pelvis is wider, and the upper limb is as compared to lower limb are shorter. And they also as per the body composition of female athletes, their fat percentage high. The normal body fat percentage for a female is around 20 to 26%, while a male athlete require at least 14 percentage, or it depends on their game also. And female athlete has a lower lean mass, their body has lower muscular mass, and their height is as compared to male counterpart is less. And in the fat distribution also, the female body has more fat distributed towards the pelvic and thigh region, and in the male it's more on the upper torso. So there is a body composition difference also, and because of this difference, the females are more protective towards the cardiovascular health. Their this body fat distributions protect them for the cardiovascular diseases. Physiological, there are physiological differences also, like heart size of a female is less, their VO2 max is also less, and but when we compared with the fat and their lean mass, the still the difference is up to 5 to 15%. Their metabolic rate is also slower rather than the male counterpart, and their less in hemoglobin. So all these hemoglobin, less lean mass, and slow VO2 max, basal metabolic rate, and VO2 max. So their performance also affects in the similar manners. But there is no difference in terms of strength gain. If a same size, same height female athlete who is practicing for the same weight, so there is a no difference in the strength gain. There might be less hypertrophy of muscles, but the strength is almost equal. But the endurance, because their heart size is small and their hemoglobin is also less, and the endurance VO2 max is also less, so their endurance capacity is less than the male. So apart from this, these major differences like skeletal differences, body composition, physiological, and the training. Uh, female has to go under menstrual cycles, and they are peculiar to the females only, and it's a natural phenomena and it's not a disease. So one has to be clear in his mind कि menstrual cycle or menstruation is not a disease, it's a normal physiological phenomena which is gifted to a female only. And this menstruation protect females from variety of diseases. And if menstruation is on time and it is regular, it boosts their bone health also and their cardiovascular health. Beginning of menstruation is known as a menarche, and generally it occurs between 9 to 13 years of age, but those games required more physical effort or more intensive exercise, it may be delayed, or because of nutritional deficiencies also it may be delayed. Like gymnasts, their menarche usually occurs at around 15 to 16 years of age, while those who are healthy and good socio-economical area, their menarche occurs as early as 9 to 10 years of age. So, and the end of menopause and menstruation is known as menopause. That means that after that, menses or menstruation or ovulation is not be occurred in the female body. And the duration of menstrual cycle, it depends from it ranges from 23 days to 35 days, and it also divided into two phases, for follicular phase and luteal phase. Follicular phase, the ovum grow in a size, and luteal phase, if the ovulation in the luteal phase, if fertilization takes place, that luteum or that grow in size and the pregnancy occurs. The luteal phase is almost fixed in a normal menstrual cycle, it is of 14 days, and while the follicular phase is generally not fixed. And the menstruation we count from the day of bleeding, and the day one the bleed start, and the last day when the next bleeding of the next cycle starts. So generally we count between two menstrual cycles. The effects of exercise on the menstrual cycles, as we just discussed, it's a delayed menarche, luteal phase defects, oligo or amenorrhea. Oligo or amenorrhea means less than 3 cycles in a year, or if a cycle doesn't comes more than 6 months, it will be considered reduced fertility. The cycles got automatically extended, and there is some in ovulatory cycles also, and reduced bone mass. And why this occurs, it's some there is a hypothalamic pituitary ovarian axis. Because of this excessive exercises and low energy level, low energy consumption as compare the body requirement, it occurs because of that. There are many other theories also, but the main appropriate theory which explain all these things are hypothalamic pituitary ovarian axis and the energy balance theory. And female athlete triad, it is very rarely all three symptoms or all three things are available in a particular patients. Like these are the three what you call classical athlete triads, like low energy, amenorrhea, and osteoporosis. All these three symptoms are rarely available in a athlete. Sometimes only two and sometimes only one symptoms appears in a athlete. As the low energy means the energy requirement or the body fat percentage goes below 20%, and the pituitary axis and hypothalamic axis its breakdown, and so estrogen hormone level is quite less, so it doesn't induce the ovulation, and because of that the menses doesn't occur. And because of their performance they have to perform in sports, so they don't eat properly, or that lead to low energy availability, and which leads to amenorrhea, and that amenorrhea leads to osteoporosis, or that leads to stress fracture or stress reactions, and low bone mass. It is not necessarily the sportsmen only. Those who all of a sudden, like military cadets or military cadets, those who just started their training in a and all of a sudden they started excessive musculoskeletal training. They generally, as soon as they start doing excess strength training, uh, they miss their periods by 2 months or by 3 months, and with this excessive training, the bone resorption or bone remodeling got affected, and the stress reactions like MTSS or pelvic or pubic bone stress fractures are quite common in military recruits or cadets.